Hello everyone, my name is Sherifat Abdusalam. I'm here to perform intradermal injection skill. The first thing I've done now is to gather my supply. I have a clean glove, I have the injection site, I have the vial, the needle, the syringe, the gauze, the alcohol swab, and the band-aid. Next thing, I'm verifying the doctor's order against the medication rights, which is to have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. I'll verify this order again against the EHR to make sure it's properly transcribed. Order states to administer morphine 6 milligram, 6 milligram intramuscular times 1 dose. What I have in hand is 4 milligram per IM per 1 ml vial. That's what I have in hand. For this, I'm going to do medication calculation, dosage calculation, which is going to be the doctor's order versus what I have in hand times volume. That's going to be 6 milligram over 4 milligram times 1 to give me 1.5 ml, which I'm going to administer. Once the dosage is calculated, I'll gather all my supply, go into the the patient's room, knock knock, provide privacy, introduce myself to the patient. My name is Sherifa. Identify the patient 2 ways, verify that with your wristband. If they have visitors, I'll ask if they want them around. This is for HIPAA protection. I'll also ask the patient if they have any non-drug food or seasonal allergies. If the patient says they don't have any allergy, I will then proceed by explaining the purpose of my visit. Mr. Smith, today the doctor has ordered to administer morphine intramuscular injection for you. Morphine is used to treat severe pain, and it works by altering your perception and response to pain. Some common side effects that you'll experience will be some urine retention, some lightheadedness, dizziness, and drowsiness. It is advisable not to operate any machinery when you are taking morphine. If you need to get up to go anywhere, please notify the staff because you might experience some lightheadedness. Some more adverse effects that you can also experience are apnea. You can have some respiratory depression and some seizure. People also, that one too, please let staff know if you start experiencing any of that. People have often said they feel some stinging and burning sensation around the injection site. This is common, but if it becomes unbearable, please let the staff know. Do you have any question? If the patient says they don't have any question, I'm going to perform hand hygiene and wear my gloves. Sorry. Once I worn my glove, I'm going to take my supply. I'm going to go back to the EHR and the cart to take out the medication. The order is for morphine injection. I'm taking out the morphine. What I have in hand is 4 milligram per ml. The injection has not expired. It is still valid. I have a 3 ml needle, and my syringe is in 22G by 22G by 1 inch needle. I'm going to set that one up. Take the vial, use the alcohol swab to clean the top of the vial. I'm taking out 1.5 ml, so with the cap still on, I'm going to push 1.5 ml of hair into the syringe. Take off the cap, put the needle over the top of the vial, push the air in, flip it over invertly, and then draw out 1.5 ml. If there are bubbles, and I'll tap or flip at the bottom to push bubbles out. Once that is done, gently take out the vial, recap with a 1-hand scoop, have 1.5 ml. At this point, I'm going to do my final check by going back to the EHR to do my 6 right. I already have the right patient, which I've verified 2 ways. I have the right drug, which is the morphine. The dosage is 1.5. The route is intramuscular. The time is 1 dose, which is now, and then I'll do the documentation after. Once that is done, I'm going to get the injection site ready. For intramuscular injection, it can be given in the deltoid, it can be given ventrogluteal, and it can be given dorsal gluteal. Today, I'm going to use the ventrogluteal side. And the way that works is I'm going to place my hand right on the greater trochanter on the patient. This will happen while the patient is lying in supine or lateral. And then once I do that, my thumb will be facing towards the patient's crotch, and my wrist will now be perpendicular to the femur of the patient. At this point, I'm going to extend the finger to lie on the iliac crest, and then I'm going to create a V. Once the V is created, I'm going to locate the injection site. It's going to be at the bottom of the V. That's where I'm going to give the iron injection. For the purpose of this, I'm using this, and for that, I'm going to perform the zigzag style, which means I'm going to use my ulnar side to push down, which ulnar side of my non-dominant hand, to push down the skin while giving the medication, just to make it tighter before administering the medication. At this point, I'm going to get the skin prep. For the skin, I'm going to do my visual inspection, palpate to see there are no burns, make sure there are no bruises. Once that is done, I'm going to take my alcohol swab. I'm going to put that from the middle and rotate round towards the outside side about 5 cm, which is about 2 inches. Once that is clean, I'll leave to air dry. I'm not going to forcefully dry it. Once that is achieved, I'm going to take the needle. Remove the cap, and then like I said, use the ulnar side of my non-dominant hand, push down the skin tight, and with the other side, I'm going to push down the injection. It's going to be at a 90 degrees. I'm going to go straight ahead and inject the patient straight up 90 degree. I'm going to aspirate. This is because I want to make sure there is no blood. Aspirate. Once I don't see any blood, that means I'm not touching, I'm still in the muscle area, I'm not touching the bone. Then I'll start injecting slowly for 10 seconds. At this point, I can release my hand on the skin, inject slowly. Once the injection is expended, once the injection is discharged into the skin, I'll wait for another 10 seconds before taking out the injection. Take out the injection, put a gauze over the injection site, apply a little pressure. I'm not going to massage, I'm not going to do anything. For the needle, I'm not going to recap it, I'm going to dispose inside the sharp container or a biohazard bag. If it's a safety needle, I'm going to activate the safety side of it and still dispose. The needle will not be recapped. Once this is done, I'm going to find out from the patient if they are okay. If the patient prefer, I'm going to put a band-aid. If they don't, the band-aid will not be used. At this point, I have completed my medication administration intramuscular, and then I'm going to gather all my used supply, leave the patient. I'm going to gather all my used supply, remove my gloves, perform hand hygiene, and document. Thank you.